Welcome to the Brain Health Hookup. I'm Laurel Myers-Hurst, your resident groovologist, and I believe that better mental health needs to be fun. Here we talk about mental wellness, we explore the physical, emotional, and relational needs we have as humans with the science and practices that help our mental health to flourish. Plus, we dive into my signature method, groove therapy, that engages folks in groove-based music making to lift mood and lower inflammation and pain. I'm so glad you're here. So let's hit it. Well. That's a deep subject. Today we're going to talk about something very controversial, the modern treatment of psychiatric conditions. That is the whole idea of chemical imbalances in the brain. So hold on to your seat. We're going to have a wild ride. You may have heard that from your primary care provider or even a psychiatric provider that you needed medication for your moderate to severe mood problems because of an imbalance of chemicals in your brain. The hope is that by giving you medication, there might be a rebalancing of neurotransmitters. This theory is so tempting because it does seem to take the burden off the individual, that the reason I'm having a mood problem is not due to my ability to handle external circumstances, but it's something inside of me, inability to somehow produce enough of these chemicals that talk between the different parts of my brain and my nervous system. The problem with this, that in 30 years of treating people with modern antidepressants like SSRIs or selective serotonin reuptake inhibitors, and like 83.4 million prescriptions for these types of medications between 2021 and 2022, depression rates aren't going down. More people aren't coming into remission. Remission meaning mild to no symptoms, or we can't tell a person in remission from someone who's not had a mood disorder in the past. So I think it's time to really take the bull by the horns, so to speak, and say, if the whole idea that chemical imbalances aren't panning out, how long do we keep on that train? If the train is heading toward a cliff of more and more people being ill with depression, anxiety, and other mood problems, how long do we stay on the train before we try to switch to a different track or get off the train entirely? And that's what I want to talk to you about today. I'm talking to you about this because many of my patients have been under the impression that their medication would bring them into remission. And after years or even decades, that hasn't happened. So I'd rather give it to you straight and talk to you about what might actually help than to just say, oh, we just haven't found the right medication yet, or we haven't manipulated the right dose yet. So we know that SSRIs, like you can name some of the common brands of SSRIs, many of the medications people have already tried are in the SSI category. Primary care doctors are pretty comfortable with prescribing it, so that's usually the first place that we go. We know that there's some manipulation of the serotonin weeks before people feel any better, and we've always thought that was a little interesting, a little strange. Some of this data is gathered from urinary samples of serotonin, which also kind of dicey whether that's a good representation of what's in the brain. But we know for sure there's a pretty significant delay between the time we can prove that serotonin's being reorganized in the brain and when people start to feel better. So why? It's always been a mystery. Well, we are looking at whether the style of connecting in the brain might be far more important than what neurotransmitters are where when. So I can just talk about this briefly and why SSRIs are specifically in question related to this. So And SSRI does not increase the amount of serotonin you have in your brain. That would be great. Serotonin is your everything's going to be okay neurotransmitter, right? If we could increase serotonin in the brain, you might think that would be effective. But SSRIs don't even do that. They actually reorganize how serotonin is moved around. So just for an example, if you have two nerves communicating to each other, and this nerve is releasing serotonin, this one is recycling it. So serotonin reuptake inhibitors shut down your recycle factories. They don't make more serotonin here. What happens then, as you might imagine, something called homeostasis kicks in, where your body's trying to bring you back to norm. This nerve over here says, hey, why are we releasing so much serotonin? Because there's already lots right here, because these recycle guys have already shut down for the day, for the week, for the month. And the body will tell these nerves to stop releasing so much serotonin. Then you need an increase in your medication and we shut down more recycle factories. But hey, these guys will get that message and they'll release less and less. And then it's kind of a race to the bottom until your SSRI does something very technical, what prescribing providers call poop out. Yes, they use that exact term. And whereas one SSRI had been sending emails to the recycle factories to tell them to close, now you need another way to call out to those recycle factories. So you change medicines, and that new medicine starts sending emails to the recycle factories. And you start again the process of reducing reuptake, consequently and sadly reducing release, and those serotonin mechanisms are completely, what I would say, hijacked. You might say modulated more kindly, but your body is being inhibited from doing what it naturally would do with serotonin. And to what effect? That's the main question. So there's been recent research showing quite clearly that in the first 6 months of depression, or in the first 6 months of treatment for depression, people can come into remission, meaning mild to no symptoms, faster on SSRIs and antidepressants, faster than people who don't take them. And at the 6-month mark, there's not really a great difference between the two of them. So about as many people will go into remission eventually, whether they are or are not on serotonin modulating medication. So the benefit is really all loaded up front, helping people feel better quickly, but not bringing more people over time to remission. So if we're looking at ways that can really help increase remission rates, meaning bringing people to mild to no symptoms, we might have to look at a totally different theory of what's going on in the brain. Not a chemical imbalance, but a structural problem where different parts of the brain that need to be in communication with each other aren't anymore in communication with each other. And some parts of the brain actually start to shrink. That's what we find very true now that we can do more detailed MRI studies and functional MRI studies that show how the brain is interconnected. We're seeing much more evidence that the structural problems of the brain are much more the cause of mood problems than strictly chemical imbalances. How does this happen? So chronic stress increases chronic stress hormones. That's a fact of nature. When you have stress, especially if it's ongoing, there's a breaking point where your body is increasing stress hormones, and they're not going down on the regular, right? They're elevated fight or flight type hormones over time. And those effects, the effects of stress hormones on the brain, cause it to have kind of a sick syndrome. It's like if you get the flu, you're like, I don't think it's a good idea to go out today. I'm going to get in my bed, cover up my head, and wait until I feel better. when you have chronic stress and highly elevated stress hormones over time, the brain also tells itself that it's just not a good time to grow and change. Your brain does naturally grow and change across the lifetime. We've known that since the 1960s. It used to be thought that the brain grew and changed up to a certain point in childhood, and that was the best your brain was ever going to be. The most connections, the most robust structure, and then it was just all a downhill slide from there. But for the rest of your life, it was just a die-off process, and it was irreversible, irrefutable. This was just going to happen, a steady, slow decline till death. Well, and since the 1960s, we've known that was probably not true, but it's been a hard thing to get a grasp on what the implications and the benefits and what it all means as far as the brain goes. I wonder in some ways if the 60s drug and anti-drug culture didn't have something to do with our conversations about neuroplasticity, because it might be easier to frighten people into not doing damage to their brain through drug use or something, because it was a use it or lose it kind of idea that if you would damage your brain due to drugs or other actions, that maybe you would never get it back. So if you fear people into, stopping their drug behavior, maybe, I don't know. But we do know that the brain grows and changes throughout the lifetime. Stress hormones decrease the amount of growth and change in two ways. So stress hormones actually shorten the length of the little hairy fibers in your nerves and also decrease their density. It might help to talk about the structure of the nerve a little bit to help understand this process better. The nerve looks like a tree blown over in the wood in the forest. You'll see the branches on one end. That's like the body of the nerve. And you have the trunk of the nerve. And then you have the roots of the nerve. So it was like the connections at the end of the nerve. Well, if you look closely in a nerve, or in a tree rather, that's fallen over, you'll see the roots and then the little tiny hairy connections at the ends of those roots. Those are like dendrites in your nerves. Those dendrites have a lifespan of about 15 months. They resorb and regrow over 15-month life cycle. And when they regrow, they reach out to whatever parts of the brain you're using that day. So you can see how certain activities and behaviors might change the structure of the brain over time. If you're sustaining a different kind of activity, you'll get more and more connections that grow in that direction. That's why structural changes in the brain and neuroplasticity have so much hope for changing mood and other behaviors, because you never stop growing. Till the day you take your last breath, your brain will be growing and changing in this neuroplastic way, day by day. Some things that decrease that neuroplasticity, like I said, stress. Stress reduces the miracle grow effect on your brain's dendrites. And it's kind of sick syndrome, a mood problem that keeps you held in place. That's natural, right? That's protective. If you're under great stress, it's not a good time to grow and experience something new. It's safer, it feels safer at least, to hunker down, not to change, to hold the status quo until the storm blows over. The problem in our modern society is that the storm is not blowing over, right? Stress is raging day by day, and the stress hormones we're experiencing because of that stress have a negative effects on the brain. How do we change that cycle? Psychotherapy puts Miracle Grow on your brain. It changes the way your brain is structured by reaching out to new ways of thinking and doing and acting, having that coach in your corner to say, it's okay. You don't have to hunker down anymore. We can plan and execute and have something new for the future. Also, a neurotransmitter called BDNF, or brain-derived neurotropic factor. Do you know that moving your lower body, like a 10 to 20 minute walk, increases the BDNF, your brain's miracle grow, by 300% for up to an hour and a half after you take that walk? We've always known that there's a strong connection between exercise and mental wellness. Now we're recognizing that BDNF may be a key part of that to keep the brain growing and changing at the standard rate, or even at an accelerated and healthy rate. You might imagine how, if your brain is having a sick syndrome due to stress, due to past painful experiences of trauma, how it might shrink in and wither. The interesting part of that lack of neuroplasticity, the slowing of neuroplasticity, is it primarily focuses on one part of the brain called the hippocampus. This is the memory part of your brain. One of the distinct features of depression and anxiety, other mood problems, is the feeling that what is happening right now is never going to change, that I am trapped, that this is hopeless, that this is beyond my ability to handle and beyond my ability to affect change. That, as you can imagine, if the memory part of your brain is shrinking away from the other connections your brain could have, and the little hairy connections there are becoming fewer and fewer in number, the whole volume of the hippocampus is shrinking. It's understandable that you would feel like your memory of any good days you did have is remote, that your fuel from past positive experiences has less effect on your present circumstances and your outlook for the future. So how do we change that? We already mentioned the ubiquitous exercise, that maybe doing some squats at your desk every hour on the hour could affect the amount of miracle grow BDNF you have on your brain through the day. Nourishing your brain in certain specific ways. There's one specific target that speeds up your brain neuroplasticity. It actually slows down the slowdowner, which, if you're following me, is speeding it up. There's actually a control lever on your neuroplasticity speed that we can change with nourishment. Reducing inflammation so that the white blood cells, the astrocytes and microglia of your brain, aren't over cleaning in some parts of the brain, reducing the connectivity between structures by over cleaning and actually irritating the brain. That's a way of helping. We also can use specific movements, bilateral movements especially, to increase your brain's neuroplasticity. And we've already mentioned psychotherapy as a very positive way of increasing neuroplasticity in your brain. How can we prove that the monoamine theory of mood problems is going bye-bye and that new neuroplastic theories of mood problems are replacing it? Just look at what is being driven in innovation in drug development and technology today. Things you have to pay for, right? Electroconvulsive therapy is still on the table. That's been shown to increase neuroplasticity, totally rejuvenate neuroplasticity. It's why it's still used to this day. Its more gentle cousin, transcranial magnetic stimulation, that uses magnets to draw the growth of the brain in a certain direction. That's another device, very, very expensive to buy it, very expensive to get it, and a lot of investment is being done in studying and implementing transcranial magnetic stimulation. Why? Because the neuroplastic changes that lead to mood changes are some of the most promising treatments we have for mood problems today. Also, investment in glutamatergic drugs. Glutamate is another one of those miracle grow neurotransmitters that tells your brain to speed up its neuroplasticity. We have a few very new drugs on the market for depression and mood problems, and then psychedelic therapies. The investment in psychedelic therapies also increase neuroplasticity. All of the money is going toward these neuroplastic focused therapies instead of so much investment in those old serotonin modulating or hijacking therapies of the past. So I'd love to give you the opportunity to increase neuroplasticity, but in a self-directed way. Does that sound good? To not put the money in the pockets of technology gurus and pharmacy, but to invest in something that gives you your own plan and your own practices for increasing neuroplasticity. There is an opportunity to work with me over 4 months to practice safe and fun ways to change the structure of your brain and to fundamentally change your life. We will definitely look at knocking down inflammation, improving nerve nutrition, and doing the movements and practices that pour that miracle grow on your brain to pull out of that sick syndrome of hibernation and waiting for something to change where your brain could grow and flourish again. We're going to create an environment together where we can flourish and see so much fundamental change over the process of 4 months. I'd love to invite you to that program called The Well-Tuned Woman, and we will be starting this fall in our beta group and again in January. So whether you're thinking now is the time or you need a little more time to process, do please look for the link in the show notes to get in contact with me about the Well-Tuned Woman. I'd love to tell you more. Thanks so much for this very, very scientifically dense talk today. Anytime we're going up against decades of a paradigm and then the potential for a paradigm shift, meaning our complete way of looking at something is changing, like there's a lot involved to it. So thanks for sticking with me. I'm so excited about the ways we might be able to change the structures of the brain rather than just hijack or manipulate so-called chemical imbalances that may not be the reason we've had these problems to begin with. So I hope this makes sense to you. If you want to call me out on anything I've said today or ask more questions, you are welcome to respond. I really look forward to fine-tuning my own understanding, my own practice, and the benefits that my clients get from working with me every day. I care about you deeply and want this so much for you. And yeah, finding flourishing in my own life in my 50s has been amazing. And I want no less for you. Thank you for tuning into this episode of the Brain Health Hookup. I hope this episode radiates with the conviction that generating mental wellness needs to be fun and safe. We want you to find your power and understand your innate design to flourish in everything you do. And we hope that inspires you to come back and listen for more. I'd love for you to leave a review of this podcast as it helps this show grow to reach more people who need to make mental wellness fun. You can find a leave a review button as well as all the YouTube visuals, bonuses, and ways we can help to support you on our website, podcast.grooveforhealth.com. I appreciate you more than words can say. See you next time, and remember, together we have everything we need.